Hi, Anastasia.
Hi.
Good to see you again. How are you?
You too. I'm good. How are you?
All good. My name is Dr. Lux, and I'll be doing your checkup today. So tell me what brings you in.
So I was on a ski trip a couple of weeks ago in Colorado, and ever since then I've been having some issues with my skin.
Okay.
I was out in the cold for a little too long some of the days, and I didn't have gloves on. I usually do, but I didn't this time, and I noticed, like, I don't know if it's frostbite or something started happening in my hands and my face.
Okay. Yeah, I do see some redness. And you mentioned this happened 2 weeks ago.
Yes.
2 weeks ago. On your faces. And what are the sensations that you're feeling right now?
So my hands, my face, and my feet, they've been kind of numb since then.
Numbness.
Sometimes even when I touch my neck with my hands, I can't even feel the sensation. I've been noticing some redness on my hands and my face, especially after I get out of the shower. They've been very dry as well.
Okay. Other than numbness and redness, have you noticed any other tingling sensations or abnormal feelings or?
Yeah, mainly on my feet and my hands, sometimes on my face a little bit as well. And I've been having a headache as well since that.
Okay.
The last couple of days that I've been there.
So the headache started 2 weeks ago at the same time?
Yeah, the same time. It was when I noticed I was out in the cold for too long. It started at the same time.
On a scale of 1 to 10, how intense is the headache?
It's not too bad, maybe like a 4, but it just feels like it's never going away. It's almost always there. It's been very annoying.
Can you point to where in your?
It's mainly in the front of my head, but also my ears have been hurting, and the surrounding area behind my ears, around them, I've been in pain as well.
You know those go-to jewelry pieces that make every outfit feel special? I found mine, and they're from Ana Luisa, a brand that I absolutely love for their very beautiful designs and sustainable pieces that are beautifully crafted and just elevate every look. I've been stacking these necklaces, and I absolutely love just how versatile they are. Whether I'm dressing up or keeping it casual, Ana Luisa jewelry always elevates my look. These necklaces are not just gorgeous, they're made to last. Hypoallergenic, water resistant, and crafted with unmatched quality, these are pieces you can wear every day without worrying about tarnish or irritation. I love knowing I can invest in jewelry that keeps its shine and stays beautiful no matter how often I wear it. And with Ana Luisa's massive holiday sale, now's the perfect time to treat yourself or find gifts for everyone on your list. Their pieces start at just $39, and the more you buy, the more you save. So it's super easy to find something for every style and budget. Plus, they offer free and fast shipping within the US with super affordable options worldwide. And every piece comes with a 2-year warranty, so you can shop completely worry-free. I've been stacking these necklaces, and I love how versatile they are. Whether I'm dressing up or keeping it casual, Ana Luisa's designs always elevate my look. Don't wait. Run! Ana Luisa has an amazing holiday sale going on right now. Ana Luisa has an amazing holiday sale going on right now. You can get your favorite jewelry pieces at great discounts of up to 35% off, so make sure to check it out using my link in the description. Jewelry is one of the most timeless and meaningful gifts you can give, and Ana Luisa's pieces are perfect for that special someone. I love giving and receiving jewelry during the holidays. It's a gift that lasts forever, so get yours today. So frontal cranial area and ears. Have you noticed any discharge from your ears? Any wetness or abnormal?
A little bit of wetness that day and the day after, maybe for like a couple of days actually, but that went away. But the pain is still there.
any abnormal sound?
No, I mean, sometimes I have ringing in my ears, but that's already been an issue even before. But it's not too bad.
Okay. Any blurred vision or double vision, especially when you get the headache?
Sometimes a little bit when I get the headache, but not every time. That day, though, I was having a bit of blurry vision and my eyes were very dry, but it hasn't been too bad since then. I've been using some eye drops.
And do you happen to remember the outside temperature during those 2 weeks while you were?
It was like negative 25 to 30 Celsius most of the days.
So that's very cold. That's extreme cold. And you mentioned you were not wearing gloves.
And I was for most of the time, but then a couple of days when I got the frostbite, I actually lost them. So the last couple of days I wasn't wearing them.
How about the hat? Was your head completely exposed to the cold?
I had a hat on, but I guess it wasn't very thick.
And you also mentioned that your feet are impacted. How about your legs?
I think up until my knee, sometimes they get a little bit tingly and numb, but that's just sometimes like after a shower or after working out.
Okay. So feet and legs up to the knee area. Okay. Have you taken any medication or anything for the headache?
Sometimes I do take an Advil for my headache, but I try not to.
Has that helped?
It does. It doesn't make it go away completely, but it helps.
Does the pain wake you up at night?
Yes, and it's hard to fall asleep from it as well. I think it's worse in the morning, actually, is when it's at its worst.
Are you on any other medication?
No. I mean, I take vitamins and supplements, but no prescribed medication.
Just over the counter?
Yeah.
And how are your energy levels?
They have actually been pretty low ever since those last couple days of the trip. I was there for a week.
Any other pain anywhere else in your body? Your back, your joint?
Well, sometimes my joints have this, like, sensation that they're really cold ever since that day. They're not in a whole lot of pain, and this doesn't happen every day, but it's like my bones are cold or something.
Okay. Have you heard any cracking sounds, any weird popping sounds when you just use your hands or your...
Oh, my hands, yes, but everywhere else it's okay, like not more than usual.
Have you had any difficulty breathing, feeling like you're, gasping for air or you can't catch your breath?
Actually, now that I think about it, when I work out, I've been at a loss for breath more than usual lately.
Right, so what I'm going to do today for you is a complete full body examination to make sure that I check out your skin and that neurologically, we're not dealing with something more than just skin exposure to cold. So I'm going to go ahead and do that today. Do you have any other concerns that I should know about?
Everything's been mostly fine, besides all those other things.
Okay, sounds good. So I'm going to go ahead and put my gloves. And I'll start by taking the vital signs to make sure that we have a good baseline.
Thank you.
And do you have a headache right now?
Yeah, but it's like around a 3 right now. It was really bad this morning, actually, but I took an Advil before I came here.
Good. So let's go ahead and just check your temperature. Have you had any flu-like symptoms in the last couple of days?
No, just besides the low energy, no, really.
Okay, so no runny nose, no sneezing.
Mm-mm.
Let's go ahead and place this under your tongue, and you can just hold it. I'm also going to check your level of oxygenation and your heart rate through the index finger. So let's go ahead and rest that. Okay. 97.9. So normal temperature. And I'm reading 99% oxygenation and 60 beats per minute. So your heart is very relaxed. And I can tell that you're working out because you have a very low resting heart rate. So that's very good. So normal temperature and oxygenation within normal limits at room temperature. Good heart rate, and I'm going to go ahead and listen to your heart and your lungs. Okay. Go ahead and breathe normally. Go ahead and take a deep breath in and out. Deep breath in and out. Okay, good. You can just breathe normally. Switching to the bell side as well for the more superficial sounds. I'm hearing S1 and S2 with no extra hard sound. That's wonderful. So lungs were clear. You did not catch any pneumonia or anything more complicated. Okay. I was not able to hear any adventitious sounds or any wheezing in the lungs, so that's very good. And the heart sounds were normal as well. Okay, I'm gonna go ahead and check your blood pressure as well. Have you ever been diagnosed with low, high blood pressure before?
No.
Okay. Is it okay if we use this hand?
Yeah, of course.
Okay, so then we go ahead and match the artery right here. And you can just rest your hand and the legs are uncrossed. blood pressure is a little bit on the low side. Are you feeling dizzy by any chance now?
I wouldn't say dizzy, but I am a little bit lightheaded.
Okay. I am 110/65. I would recommend that you increase a little bit your salt intake. Do you usually use salt in your diet?
I actually only started doing that a couple days ago.
Okay.
Because I read that I think I might be lacking some based on some of my symptoms. But I haven't been eating a whole lot of salt my whole life.
Yeah, and also sea salt. That would be very good to include in your diet, so that you get all of the minerals, not just the sodium, iodine-based table salt, but also sea salt that has more minerals might help increase that blood pressure a little bit.
Okay, thank you. I'll do that.
Okay, so I'm gonna go ahead and just inspect your appearance right now. And I'll be checking for anything abnormal on your skin, any redness. I can already tell that there are some spots that are a little bit red. Especially on your neck, over on the left side. Okay. The right cheek is a little bit redder than the left one, and same pattern is maintained on the neck as well, going to the chest, but the difference is not very big, so I'm not too concerned. Okay, I'll be looking at the inside of your arm as well. Good. Paying particular attention to any colors that are on the blue-purple spectrum, which I'm not seeing. The numbness is a little bit concerning, especially when there are no physical signs of intense frostbite. So do you feel this equally on both sides of the forehead?
I feel it a little bit more on the right side.
And do you feel this equally on both sides of the cheeks?
A little bit more equal there, but the right side is worse, especially closer to the ear.
And how about this?
It actually feels pretty okay there.
And this?
The same thing, the right side is more sensitive. And the same thing there as well.
Okay. I'm gonna go ahead and palpate your head. Check for any lumps, bumps. Any pain when I apply pressure?
Yeah, especially in the front.
Okay, on a scale of 1 to 10.
That was like a 6, 7, something like that.
How about when I apply pressure laterally? Any pain there?
It's more like a 2, 3, especially on the right side.
How about when I apply pressure?
Oh, it's actually really bad there. Like
the ears?
8, yeah, 8.5.
I am sensing an inflammation over on the right side here. So the mastoid bone process is definitely impacted. Could be an infection, it could be a reaction to the cold. So let's go ahead and check your ears. First, I'm going to do a hearing test. So I have here a tuning fork, and I'm going to strike it and cause a vibration. And I will place it near your ear in 2 positions. And I want you to tell me which one is louder.
Okay.
So that's position 1. And position 2. Which one is louder?
1.
1? Okay, good. And now I want you to tell me when you stop hearing a sound.
Okay. No.
Good. Okay, now we're going to do the same thing on this side. That's position 1, position 2.
I kind of hear them both the same in that area.
Okay. And now tell me when you stop hearing a sound.
No.
Good. Okay. And now I'm going to strike the tuning fork again and place it on various parts of your body. And I want you to keep your eyes closed and just say yes when you feel it.
Okay.
I'm trying to detect how well you can sense the touch.
Yes.
Good.
Yes. Yes.
Good.
Yes. Yes. Yes.
Good.
Yes. Yes.
Good. And now can you feel this?
Yes.
Good. And this?
Yes.
This.
Yes.
All right. So let's go ahead and look inside the ear. And I'll be taking a peek inside your ear canal, and I want to see if I can spot any infection or any abnormal discharge, anything that would require us to put you on antibiotics.
Okay. Sounds good. Thank you.
You can look over to your left. I'm going to go ahead and just slide this inside the ear canal. Okay. I'm able to visualize the ear canal. I see the tympanic membrane, pearly gray color, a little bit of a discharge. And if I just go a little deeper, oh, yeah, I can definitely spot an infection. And I can see why your mastoid bone process is so inflamed. Yeah, definitely I can tell that you have an ear infection going on, and the whole inner part of the ear canal has a lot of wetness and a lot of discharge. So I'm gonna go ahead and make a note of that, and we can definitely put you on antibiotics.
Thank you.
I'm going to prescribe 750 milligrams of amoxicillin that I want you to take twice a day, so once every 12 hours for 7 days. Okay. And let's go ahead and look in the other ear as well, just to compare, and so that I have a good baseline for the other ear. early grade tympanic membrane. Bony landmarks are present. Whitish filament, well-defined margins, and no discharge. Good. This ear is clean. Okay, so that concludes the ear exam. We'll put you on antibiotics and clear that infection right out. I'm gonna go ahead and focus on your eyes. And first I'm going to check with the light. So I want you to look into the distance, and I'm gonna check for the pupil reflex. Good. 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 And I want you to look at me now, right here. Perfect. So no concerns with your eyes. Next up, I'm going to check your cranial nerves to make sure that neurologically everything is okay. So I'm going to push on you. I want you to kind of resist my push. I want to check how strong your back muscles and just your overall spine is.
Okay.
Okay, good, perfect. Now I want you to squeeze my hand. Good, perfect. And now I want you to keep your head steady and to just follow my fingers with your eyes on it. Okay, good. 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 Perfect. Okay. I'm also going to take a peek inside your optic nerve and optic disc, and just make sure everything checks out over there. Okay, so go ahead and look into the distance for me. Going to get a clear picture of your eye first and calibrate my device. Perfect. Then I'm going to get really close and check the optic nerve and optic disc. Good. Now look into my ophthalmoscope device. Perfect. Good. Now I'm going to do the same in the other eye. Look up for me, down, and now into my device. Perfect. So, eye exam is all good, no abnormal findings, good ratio on the optic nerve. No shadows, no scratches on the retina, and good mobility. So cranial nerves 4, 5, and 6 are okay. Can you move your head left to right for me? Any pain when you do that?
Yeah, when I moved my head to the right just now, I felt it like here. Some tingling.
Okay, I'm gonna do a neck inspection in a moment after I'm going to ask you to lay down.
Okay.
But before we do that, I am going to check your skin a little bit more.
Okay.
So I'm going to ask you to close your eyes, and I'm going to touch you with something that feels just very soft. And I want you to tell me if you feel it on your left side or your right side of the body.
Left. Right.
Okay, good.
Left. Right. Left.
Right.
Left. Right.
next up, I'm going to give you something to taste. And we're going to make sure that cranial nerves are intact and that your sense of taste is not impaired.
Okay.
Go ahead and just, yep, and now close your mouth and open. Good. What does that taste like?
Like raspberry.
Good, perfect. So you're able to taste just fine. And I'm also going to give you something to smell. With both of your nostrils unobstructed.
No, it's like orange.
Good, perfect. And now I'm going to ask you to close one of your nostrils.
Okay.
And no. Smell this as well.
It's very chocolatey.
Perfect. So cranial nerves that control the sense of taste, touch, and smell are intact. Wonderful. I like you to lay down now so that I can take a look at your neck a little more and palpate, make sure that the lymph nodes are all okay, and then I'll check your abdomen, your legs, and your feet.
Okay, sounds good. Thank you.
Okay, I'm gonna go ahead and palpate your lymph nodes. And you can just close your eyes and relax. I'm gonna make sure that I'm not missing any inflammation signs that may have to do with how the fluid drains in your body. Okay, so I'm checking the pre-auricular and posterior auricular lymph nodes around your ear. And now the tonsillar lymph node and the submental. Good. Cervical. And we're on the right side, where I was able to notice most of the redness. This is where the mastoid bone process inflammation is also happening. I'm gonna go ahead and try to feel for any indentation in your skin. There is an overall inflammation. But it seems to be evenly distributed. With no micro indentations. Good. I'm going to check your sinuses as well. be gently tapping on your face. Let me know if you feel any pain.
No pain. A bit of pain there. A little bit of pain there as well. There too. Yeah, it's actually really bad there. It's a little less, but still there. Also some pain. It's getting less the further you go back. A little bit there. There too.
So it's mostly localized in the front area of the ear. Let's try to tap in the back of the ear as well.
Oh, it's really bad there.
Okay.
There too. There also. Not so bad there. My skin just feels a little weird there, but it's not too bad.
Do you feel this?
No.
How about this?
I felt a little bit, yeah.
Interesting. Do you feel that?
Yeah. Very light. I felt it closer to the top of my neck. There, I felt it, yeah. I felt it there too. I felt that also. And there. There too. I felt it there too. And that too.
Okay, do you feel this? And that? How about this?
No.
And this?
No.
This?
Yeah, I felt that. That too. Felt that. Felt that too. Felt that too. And that.
Okay. So you do have some loss of sensation, but it feels pretty just irregular. There's no obvious pattern, and it's spread out on the right side of the neck in just patches. So this could be because of frostbite. Do you feel this?
No, I heard it, but didn't feel it. I felt that, yeah.
Okay.
Didn't feel that.
Mm.
Didn't feel that either. Felt that.
Okay. So definitely the neck is affected. I'm gonna do just a deeper palpation in the neck. Supraclavicular lymph nodes are not enlarged. I'm looking for any masses or any indentations that are in the deeper parts of the skin. Nothing other than the inflammation here in the mastoid bone process. Okay, let's take a look at the abdomen next. Okay, Anastasia, I'm going to take a look at the abdomen. Is it okay if I lift your top just slightly? And then is it okay if I expose your belly button?
Yeah, of course.
I'll be doing a visual inspection first. It's part of the routine checkup just to make sure we're not missing any physical signs. So, standard basic clinical exam. Good. I'm going to go ahead and listen to your abdomen. So just breathe normally. Good. I'm hearing activity in all 4 quadrants. Some gurgling, which is within the normal range of activity in the abdominal area. Switching to the bell side for the superficial sounds. And again, rechecking the 4 quadrants. Good. I'm not hearing any signs of obstruction. I'm going to go ahead and feel the pulse, and that is in between the 5th and the 6th intercostal spaces. That's the pulse of maximum, the point of maximum impulse. 2, 3, 4. Good. So that's normal. I'm gonna go ahead and palpate your abdominal area. Checking for any hidden masses or abnormal enlargements of your internal organs. Checking the stomach. Good. Normal size. And the liver. Can you lift your leg slightly so that there's no tension in the muscle, and take a deep breath. And now exhale. Good. You can lower your leg now. The tip of the liver was barely palpable, and now I'm going to press down on your kidneys. Good. You have strong abdominal muscles. Alright, perfect. I'm going to go ahead and take a couple of measurements. That's 30. Checking the overall proportions of your body. 35. Perfect. Okay. Next up, I'm going to check the skin on your abdomen, and I'll start off by just making sure there are no indentations or bumps inside the skin.
Okay.
So go ahead and relax. Nothing hidden underneath the skin. Okay. Are you able to feel this?
Mm-hmm.
Good. And now, can you tell me if you feel me touching you on the right side of your body or the left?
Okay. Right. Left. Right. Left. Left.
And how about now?
Right. Left. Right.
Perfect. Now I'll just be doing some tapping and percussion to make sure that the resonant sounds are okay too. Good. Nice and bass. Bass sounds are good. Similar resonance throughout the abdominal cavities. That's all quite normal. Okay, I'm gonna go ahead and check your legs next.
Thank you.
Okay, I'm gonna go ahead and take a look at your legs next. And I'll be doing just a visual inspection first. And trying to make sure there are no signs of frostbite. You have one bruise on your right leg. It looks a little bit bluish. Does it hurt?
Not anymore. That's from when I was standing up from my desk at work.
I'm gonna go ahead and percuss your legs and check for any pain.
And there's some pain at the bottom of the knee.
Right here?
Yeah.
How about here?
Yeah, there too. It's like dull.
So the kneecap is impacted. Palpating around it. Do you feel any pain here?
Not at the top, no.
So just the bottom. Okay. Do you feel this?
I feel it, yeah.
And this? This? Okay, and how about this?
Yeah, I feel it. I feel it less there toward the bottom of my leg, but I still feel it.
feel that?
Mm-hmm.
Okay, do you feel this?
I feel it less on my foot and the bottom of my leg. I feel it more the higher you go up.
How about this?
It feels kind of tingly and weird up next to my toes. Yeah, it's like a weird, numbing, tingling sensation on my feet.
Okay, let me go ahead and take a look.
Yeah, it feels really tingly on my toes.
Do you feel me touching on your big toe?
No, actually.
Do you feel me pulling on your big toe towards your head?
I feel it like on the base of my toe.
On the base, but not at the top.
Mm-hmm.
Okay. So there may be some nerve damage towards the extremities and alongside the shin here. Definitely a neurological impact from cold exposure. Can you curl your toes around my finger? Not too much. Okay. They are very cold, so the blood flow must not be optimally flowing here. Okay. Do you feel this?
No. That I feel. I feel it, but it's like feels weird, kind of like tickly, tingly.
And this?
Same thing. Same thing there too. And that made a nerve sensation above my knee actually.
Oh,
Yeah.
okay. So you felt it here?
Like above my knee and my mid thigh.
Okay.
I felt it like shoot up there.
Can you tell me if it happens again?
Yeah, it's the same thing.
Interesting. Okay, so definitely nerves are impacted. Okay, I'm gonna go ahead and check the plantar region of your feet as well.
Okay.
So we're definitely dealing with nerve damage on the right side of the foot and the leg here, and that is radiating up all the way towards your neck area, so the right area is mostly impacted. I'm gonna go ahead and palpate the plantar region. Let me know if you feel any pain.
I feel some tenderness on the middle of my sole.
Right here?
Yeah, like at the middle of the center. It's tender.
The feet are not swollen, but the right plantar region is more tender than the left. Okay. Just say yes when you feel me touching you.
Okay. Yes. 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 I felt it very subtly, less than the other. No, I don't really feel anything there. Yes.
Eight and 8. 3 and 3. 22. expected symmetry is in place. Go ahead and push into my hands with your pad. Good. And now try to use just your toes to push into my fingers. So left one is good, right one impaired mobility and strength. Okay. Okay, Anastasia, this concludes the assessment for today. I was able to find some nerve damage, especially on the right side of your body, which is much more impacted from the cold than the left side. So I do want us to first take a CAT scan, right? And just make sure that there's nothing underneath the skin in the deeper layer of the tissue that's impacted from the frostbite. And then if that's not the case, then we'll just go through a dermatological treatment to just get your skin back to where it's supposed to be.
Okay, sounds good. Thank you.
I did prescribe you antibiotics for the ear infection. Okay. I sent those to your pharmacy.
Perfect.
And let's come back and see each other in about 2 weeks to see how your skin has progressed, and then review the results of the MRI.
Sounds good. Thank you.
Yeah, thank you as well. Good to see you.
You too.